Maria, a very, very good morning to you. When I say you are a nurse, suppose you're trained, you're always a nurse. I'm fascinated with this, Maria. Tell us a bit about your nursing, where you did it, and the experience that you got from it.
Yeah, so I trained, I've been in the health service nearly 30 years, so I'm feeling extremely old today. I trained at Mayday, what was called Mayday in Croydon. It's now changed its name. I worked at St Thomas's in London, but I spent most of my time at the Royal Marsden in London as a cancer nurse. And it was actually working as a nurse that got me into politics, because I moved down to Brighton and one of my local hospitals was under threat of closure, and I got on board on the campaign to save it, and thankfully it's still going. But it's a slippery slope in politics. Once you get involved in one campaign, before you know it, you're standing for Parliament. So I never meant to stand for Parliament, and it was really my experience of the NHS that really got me involved in politics.
You see, that qualifies you in so many areas with your experience, including the strikes that go on. And the thing that gets me, Maria, we sit here day after day, and one side says this, the other side says that. It doesn't seem to be any closer to an agreement with doctors, junior or senior.
No, I agree, and our call is really for the BMA really to get back around the table and have those conversations. We did listen to the consultants when they said pensions were an issue, and we resolved that in the spring statement. The Chancellor lifted their lifetime allowance. We've resolved it with the nurses, which is great news. Over 1 million workers now will be getting that extra pay in their pay packet this month, which will really make a difference. So it is the junior doctors and the consultant strike that is the main one, and that's going to have a big impact on patients with appointments and procedures being cancelled. So absolutely, we want to resolve this for patients, but it's also happening in Wales, where Labour government run the health service there, and in Scotland with the SNP. So the strike action across the UK, but in England we absolutely do want to resolve that with the unions, and would urge them to get back around the table for talks.
Although so many people will just assume this is the new normal, as you say, many operations, 650,000, and that waiting list somewhere around 7.4 million, possibly could well go up. And then the Health Secretary coming out today saying what we need is evolution, not revolution. Everybody knows how long evolution takes.
Well, absolutely. But what I would say on the waiting list is, although we've got more people on the waiting list, the waiting times are coming down. And I think for most people who are waiting for an operation or a procedure, it's how long they wait, not who else is on that waiting list. And we've eliminated the 2-year wait. We've virtually eliminated the 18-month wait. And we're now working on those who are waiting for a year. So it's really important that we do that. And strike action doesn't help, to be honest. It does mean that procedures and operations are often cancelled. So that's why we do want the unions to come around the table and try and resolve that for patients.
Yeah, and public satisfaction is incredibly low. A new survey showing 1 in 3 have been able to get access to services since the pandemic. Waiting lists affecting 1 in 8. We've obviously got an ageing population. Lots of questions about whether this current model from birth, some cradle to grave, actually is sustainable. And we hear people, former health secretaries coming out saying it's time for a royal commission. Even Tony Blair coming out and saying that. What's your view on that?
Well, the only thing with the Royal Commission, I would say, is that takes years, and the announcements we've made over the recent months are about improving services now. So our workforce plan is about getting more doctors and nurses and healthcare professionals in primary care and secondary care, but also in terms of our investment in our infrastructure. So we've got our 40 new hospitals, we've got over 100 new community diagnostic centres so people can get their tests more quickly. We've got surgical hubs, over 100 of those being opened, so people can get their operations more quickly. They're the sorts of things that will make a difference, both now in the short term in terms of those waiting lists, but also will future-proof the NHS as well. So a Royal Commission, it's good in theory, but actually that won't produce results for many, many years, and we need to focus on the here and now.
Well, obviously, Sajid Javid wouldn't have said what he said if he was in office. And this is the frustrating thing, talking to guys like you, politicians like you. I mean, we're totally aware what you can say and what you can't say. But what I'm trying to tickle out of you is, if you were in charge, if you were running the show, not to undermine your boss or anything like that, but what do you think from your experience as a nurse, what you've come through the years, what is there? People talk about it needs more investment, it needs more staff, it needs whatever. What do you think the NHS needs if you could wave a magic wand?
Yeah, so from my experience, it isn't just about how much money you spend on the NHS, it's how you spend it. So, and I don't want to be too party political, but when Labour in government, they spent a huge amount of money trying to roll out an IT system, spent billions on that never saw the light of day. And the money that we're spending now, whether it's investing in staff, reintroducing the apprenticeship routes for many healthcare workers, whether it's about improving the buildings. I know from my experience, I've worked on long, old Nightingale wards. They're very difficult to nurse in. There's no privacy for patients. There's no space to be able to do procedures. And making those changes, making our buildings, our hospitals, our diagnostic centres fit for the future, that makes a difference for the staff. It helps with retention, but it also improves the experience for patients. And I think it's what you do with the money, not how much you spend, that is as important.
Can I just ask about, just while you're there, about staff? Maria, I've spent 3 weeks in 2 NHS hospitals in the last year, and I can honestly say to you, I understand how it saves you money, but there is a massive difference being treated by a member of staff and an agency person that comes in. And I'll tell you what it is, Maria. It's the handover, it's the join up, it's the investment. And not the individuals themselves are very talented, that's all fine. But they're not invested in the process in the same way that the other staff are. And so you may save money with agency staff, but you're losing out on a joined-up strategy, on, as you said, about nursing on the wards there. I could see it was obvious it's a problem. Agency staff, they're needed, but there are too many of them.
Yeah, no, and I'm a bank nurse myself, so I'm not on an agency, but absolutely. And when I was a nurse in charge on the wards, it's actually very difficult when you've got lots of agency or bank nurses because they are there just for the shift, and they may not be able to do many of the procedures that the substantive full-time permanent staff can do. And so that's often a factor in staff retention. If you're busy on a ward and you're working with a different kind of set of nurses every single day, that's quite tricky. So that's why we've got our long-term workforce plan. So we increase the numbers dramatically. We're doubling the number of nurse training positions because we need to get those permanent, whether they're part-time, full-time staff on the wards, and absolutely reduce the use of agency staff because it actually does cost us quite a lot of money as well to find those agency staff. But as you say, they're there for a shift. Their ability to be able to transform care or be able to have that continuity of care for patients is also limited. They do a great job. We do need them, but you're absolutely right. That's the direction of travel. That's why we're spending £2.4 billion both for nursing agency staff to reduce their use, but also for medical locums as well. Because absolutely, Eamonn, that's the experience both for patients and nurses is better when you've got permanent staff.
Yeah, and hugely costly, as you say. And look, you were saying earlier, it's not how much you spend, it's how you spend it. And you talked also specifically about that waiting list and almost sort of dismissive of the fact it's 7.4 million people because you're saying that the waiting time is being reduced. But I just want to ask you, do you think it's acceptable to have a waiting list of 7.4 million? And are you comfortable with that waiting list getting longer?
Well, we know during COVID, and I know there was waiting lists before COVID, but we know during COVID where we had to shut down kind of routine care, that helped build up the waiting list that we have now. And we expect that to actually climb a little bit before spring next year.
What's a little bit when we're talking about 7.4 million?
So, I think we're almost at the peak there, but what's important is how quickly people get those procedures, and that has fallen dramatically. So people were waiting 2 years this time last year. They're now waiting around a year or less, and that's the important thing. And, they've not been able to do that in Wales, where Labour run the health service. Many thousands of people are still waiting for 2 years there. But absolutely, that's why we're putting so much investment. We're increasing the number of staff. We're improving the facilities. Surgical hubs, for example, not being part of the acute side of a hospital means that they're less likely to see operations cancelled because of an A&E admission or an ITU bed not being available. That will absolutely speed up how quickly we can get people their procedures. The rapid diagnostic centres where people can go for CTs and MRIs, again, they're not being impacted by the acute side of the hospital where maybe someone in A&E needs that urgent MRI or CT. And so it's about how we have the services as well as kind of, the traditional way of doing things, because you can get through those waiting lists much, much quicker if you have these kind of standalone facilities which are not impacted so much by what's happening in the acute side of a hospital trust or in a GP practice as well.
Maria, could I just say it's a pleasure talking to a minister who is an expert in their field, who knows what they're talking about, who's invested in their particular field. So I just want to say that's very refreshing talking to you. It's been very interesting hearing from you this morning. Thank you very much indeed. Maria Caulfield is the Health Minister and a former nurse. Thank you very much indeed.